This is CGTN, China Global Television Network.
COVID-19 cases worldwide approach the 1.5 million mark. The US reports nearly 2,000 deaths on Wednesday. UK Prime Minister Boris Johnson's condition improves while France maintains nationwide restrictions. African leaders criticize the US president's attack on the WHO, and even after Wuhan's lockdown ends, the city continues to follow strict prevention and control measures. Hello and a warm welcome to Africa Live on CGTN. I'm Lindy Mtongana in Nairobi. Also coming up this hour. In business, OPEC members and other oil producers set for a virtual meeting to steady oil prices. And in sports, the World Athletics Championships in Oregon rescheduled to July 2022. We begin with the latest on the COVID-19 pandemic. The total number of confirmed cases worldwide is now approaching 1.5 million. Over 88,000 people have died. The United States reported nearly 2,000 fatalities on Wednesday. Cases there have surged to over 430,000. That's more than a quarter of the global total. Meanwhile, over half of all cases are in Europe, with Spain and Italy the worst hit. Iran, the epicenter of the outbreak in the Middle East, has registered more than 64,000 infections. The Chinese mainland reported 63 new cases on Wednesday. 2 were local transmissions and 61 were people returning from abroad. Now, concerns are growing as British Prime Minister Boris Johnson remains in intensive care for COVID-19. Foreign Secretary Dominic Raab is now leading the government's response and is bearing more and more pressure with the increasing number of confirmed cases and a low discharge rate. Testing remains one of the key issues in the United Kingdom. Britain still lags behind countries like Germany in its testing program. Well, for the very latest from the UK, let's now cross live to Andrew Wilson, who joins us from London. Andrew, Boris Johnson has spent a third night in ICU. Can you give us an update on his current condition?
Well, third night in intensive care. That's now him starting his 5th day at St Thomas's Hospital in Westminster. Now, at the government briefing to the country last night, Rishi Sunak, the Chancellor, said that the Prime Minister was stable, that he was making good progress, that his temperature had fallen slightly yesterday morning. But most importantly, in the line that was reported in the UK media pretty freely last night, is that he said that Boris Johnson was sitting up and engaging with hospital staff and in good spirits, which paints a much more lively picture for the country to take heart that the Prime Minister is still making good progress. He is still in intensive care, and you don't go there unless they're concerned that your health may dip suddenly and you might need a more rapid intervention. So he's certainly not out of the woods yet. And that's still creating problems and questions in the country about how Downing Street is able to make serious decisions and to take on board differing and perhaps contradictory advice and make that crucial prime ministerial steer without Boris Johnson present, or without anything in any kind of legally written phraseology to suggest who takes over as prime minister or makes those decisions. Dominic Raab is deputising, but really that's just chairing meetings, the government meetings every morning, and the more serious ones once a week about following scientific advice. But that absence of a figurehead in government is growing to be more of a problem day by day.
Yeah, and of course, and that's as deaths keep rising. We understand that the UK recorded over 938 deaths on Wednesday. We are hearing reports that a lockdown may be extended. What more can you tell us, Andrew?
Yeah, I think it's an interesting one, this, because there's been a fair amount of speculation about whether or not the lockdown will be extended. That's mainly because 23rd of March last month, Boris Johnson suggested that they would lock down social distancing across the country for 3 weeks and then reassess after 3 weeks. Well, that reassessment comes up on Monday next week, Easter Monday, as it happens, which is a national holiday. And there's been some speculation that in the absence of any kind of information from the government, perhaps they might change the rules. But all the science and all the experiences of Italy, France and Spain suggest that the lockdown has a long way to go. And I think we're going to hear more on that today from the government. There'll be a government briefing this afternoon, which is more than likely going to be held by Dominic Raab, this man, Foreign Secretary, deputising for Boris Johnson. And he's probably going to reiterate this, that all the scientific advice suggests that this lockdown must continue at least until the epidemic in the UK and the pandemic around the world, but particularly the epidemic in the UK, is seen to have peaked in some way. The numbers are still awful. The death rate yesterday, the worst to date so far, but it is decelerating. It isn't accelerating as fast as the graphs were, say, a week ago. So the government's optimistic that there's a peak there somewhere, but it's still more than a week away, most people think.
Indeed. Well, thank you so much, Andrew Wilson, joining us there live from London. Well, let's take a look at the latest COVID-19 numbers coming out of other parts of Europe. Italy has reported more than 500 new fatalities in just the past 24 hours. That brings the total there to over 17,000. That is the highest globally. It's followed by Spain, which has reported over 14,000 deaths. France has registered more than 110,000 infections. The presidential palace has said the nationwide lockdown, which is due to end next Wednesday, will be extended for a second time. Well, let's get to more now on this. We're joined by Ross Cullen, live with us in Paris. Ross, another tough 24 hours for France, with 541 more coronavirus deaths reported in hospitals. Can you give us an update on the situation?
Yeah, that's right, Lindy. We have had more than 112 people now confirmed to have been suffering from the coronavirus here in France, and those cases through 10,000 now when you look at the number of fatalities. France, the fourth country, unfortunately, to go through that mark of suffering 10,000 people who've lost their lives. One slight glimmer of hope is the fact that the number of people who have been admitted to intensive care units, that has fallen for the third day in a row, and that has been coming down, and people have been looking at that for some small signs of positivity, but the situation as a whole is still very serious. The health secretary saying we're not even at the end of the beginning yet. We haven't reached the peak of the epidemic, and we still need to be focusing on giving as much support as possible to the healthcare system. One thing we have seen is people being moved around the country, particularly taken to the west and to the south from the two hardest hit areas. One of those is here. Ile-de-France is the name for the Paris capital region. That, along with the Grand Est region in the east along the German border, they have seen where capacity has been really at a peak, where hospitals have been overwhelmed, saturated with cases, and they've had to move people to free up some capacity for the new patients who've been confirmed. So that's one area they're looking at. Also, another serious situation is what's taking place in care homes, known as EHPAD here in France. There's nursing homes for elderly people living in assisted living facilities, and we have seen now the data from care homes added into the national statistics when it comes to the number of cases and the number of fatalities.
And of course, Ross, what we're hearing as well is that experts have warned that France is in fact yet to reach the peak of cases. What can you tell us about this, and what's being done to prepare for the fact that the numbers still might rise?
Well, the main thing that looks to be happening now, Lindy, is an extension to the lockdown measures here in place in France. They were due to expire on the 15th of April next week. The Élysée Palace, representing the government, has already said those measures are going to be prolonged. We haven't got official dates yet for when that new extension might end, but it seems to be pointing at least until the end of April. President Macron was due to speak this evening, Thursday evening. He's now delayed his latest address to the nation till Monday. That's when we are expecting the official dates for the prolongation of the lockdown to be announced. Emmanuel Macron has made 3 other speeches to the nation since the outbreak began here in France, and this is due to be his 4th as the government really tries to show that it has a handle on this. It has dealt with the mask issue, it says, by ordering more from China. It's dealt with the ventilator problem by ordering more from Germany, and it's now stepping up production of ventilators inside France as well. Medical experts here really saying that France shouldn't be talking at all about an end to lockdown. That's something that simply cannot be considered now. It needs to be extending the lockdown. It needs to be assuring people to stay at home to try to contain the spread, as France unfortunately follows Italy and Spain as one of the hardest hit countries in Europe.
Ross Cullen, thank you so much for that update, joining us there live from Paris, France. Now, the head of the World Health Organization has given a pointed defense of the agency's handling of the coronavirus pandemic. He was responding to U.S. President Donald Trump's criticism and his threats to withhold funding. Nathan King has more.
We're going to put a hold on money spent to the WHO. We're going to put a very powerful hold on it.
On Tuesday, U.S. President Trump used his daily briefing to threaten to cut off U.S. funding for the World Health Organization. After praising the global body for months, he now says it was wrong and too China-centric. Well, on Wednesday, the Director General of the WHO hit back, saying politicizing COVID-19 will only lead to more deaths.
If you don't want many more body bags, then you refrain from politicizing it.
The apparent deflection by the US president came as the US death toll passed 14,000 for the first time, and New York recorded nearly 800 deaths in a single day.
Just the white.
And on this nation's darkest day so far, however, some hope for the future, from new predictions for the final death toll, which could come in far lower than previous estimates.
We're getting closer. You see the numbers. We're getting much closer to getting our country back to the way it was. We have now an extra 2 countries that have been attacked, 184. They're being attacked as we speak, but we'll all win. At some point, we're going to all win. We're going to do it sooner than people think.
Meanwhile, warnings here in the US from authorities about new hotspots around the country. The city of Washington, D.C. here is one of those, as are neighboring states of Virginia and Maryland, Pennsylvania too. This virus continues to spread. Nathan King, CGTN at the White House.
Well, staying with the U.S., earlier we spoke to Chen Shi, the assistant professor at Yale School of Public Health in New Haven, the U.S. We asked him why African Americans face a higher risk of dying from the coronavirus.
The first is the widespread misinformation among Black Americans regarding the coronavirus infection, so they need more health education to improve their understanding and their hygiene. And also, they have higher rate of Black Americans are in the low-paid jobs or inflexible jobs. So they do not have the privilege to work from home. Their job putting them at a higher risk. For example, they work on the front lines and they work in the public transportations or food and delivery services. And also, there's no flexible arrangement like housing policy to shelter them after they return to home. That put them and their family members at the danger of cross-infection and family clustered infection. And those high infection rates sometimes translated to a high death rate because Black Americans usually have a higher rate of chronic conditions like diabetes, heart disease, and high blood pressure, and which contribute to a higher death rate. And other contributors involve, for example, they have less access to the testing kits, which means that when they understand that they are infected, which may be too late for treatment.
To China now. Today marks the second day of Wuhan's lifting of travel restrictions. The central Chinese city went into lockdown in late January due to COVID-19, and the unprecedented measure lasted for more than 2 months. Feng Yilei filed this report.
Actually, I'd say the recovery of transportation in Wuhan is pretty remarkable, with over 70% of bus lines and subway lines are back in operation. Crowds swarm bus stations, taxis, trams and ferries, and we even got caught in a small traffic jam on our way here this morning. So On the first day since Wuhan lifted its outbound travel restrictions, we saw tens of thousands leaving the virus-ravaged city for work and family reunions. By the time we left Tianhe International Airport at about 9 o'clock last night, we saw nearly 200 inbound and outbound flights carrying over 10,000 passengers. And at the same time, 55,000 travelers left the city on about 276 passenger trains. And the number of vehicles driving out of Wuhan via highways exceeded 150,000, which is up to 500 than the previous day. But at the same time, Wuhan has restored 30 more bus lines and the traffic arteries, including the Yangtze River Bridge, water taxi and ferry have recovered gradually. It's not time for complacency, I'd say. What people here talk most about these days is that zero growth does not mean risk-free, and we need to prevent the second wave of the outbreak to not let Wuhan's sacrifice go in vain.
A Zambian expert, Benedette Dekazulu, has hailed the lifting of the lockdown in Wuhan. She sees it as a milestone in the fight against COVID-19. Dekazulu is the Executive Director of Policy Monitoring and Research in Zambia.
Not only for Wuhan province, even for its other provinces, China has done a very good job in making sure that, other provinces are not affected heavily the way Wuhan was, by immediately intervening to lock it down and be able to seriously look into some health interventions and how healthcare practices have been put into operation in a very short time space. And to date, we have seen at least, very good news that China has actually uplifted the lockdown for Wuhan. China has really shown the way in the way that they have put up a fight, been able to mobilize resources in a very short period of time, and put up, technologies and strategies that have shown the world that indeed this is a country that values its people, and healthcare is number one, and most of all, human life is put at the centerpiece.
You're watching Africa Live. More news after this short break.
Each day, there are millions of stories. Each one can open new perspectives, new possibilities. Wherever you look, we are there to see, discover, explore. We put the pieces together to find what really matters to you, all around the world, all around the clock. Our reporters are at home across the globe. From our headquarters in Beijing and production centers in Washington, Nairobi, and London, China Global Television Network. Stories from across the globe, reaching people across the globe. CGTN. See the difference.
Welcome back. We start in South Africa now, where the total number of confirmed COVID-19 cases has risen to 1,845. That's an increase of 96 from the previous reported cases. This, according to a statement issued by Health Minister Zweli Mkhize on Wednesday night. Meanwhile, concern is rising over the fate of thousands of homeless people in the country. In Cape Town, local authorities have built a camp to house the homeless during the current lockdown. CGTN's Travis Andrews has more.
The South African government has been keen to ensure all people obey the current lockdown order. But for many homeless people, following those orders has been difficult. Now, Cape Town city authorities have moved to address that problem. They have built a high-security camp to house them. The homeless will receive support services including medical tests and treatment for all ailments.
the city does not have enough capacity to man these facilities, whether it's through social development, whether it's with our law enforcement, Metro Police, and even SAPS. And so the better approach was to consolidate the individuals and the services on one location, which we're doing here. We're offering, behind me is the medical tent where every individual is being screened for every condition, TB, COVID, chronic lung diseases.
There are 7 tents in total, housing over 4,000 street people. All of them will be screened for COVID-19 symptoms before being kept under mass lockdown. Hundreds of police officers are also keeping a close eye on proceedings. That's because some of those kept here have already tried to escape the facility by scaling the walls. Now the city has decided to maintain a very strong security presence here in order to prevent the possible spread of COVID-19 to the surrounding communities. But the city says it's not just a lockdown camp meant to force the marginalized to comply with government orders. They say they're trying to help them reintegrate into society and also treat cases of substance abuse.
With this intervention, we hope that not necessarily they will be better people. They are better people, but we instilling the hope because we know that they are homeless, but they are not hopeless. After this, they will have hope to go and be integrated with the community and with the families.
For now, none of these essential workers seem to know whether the national government may or may not extend the national lockdown. It all depends on the infection rate figures that will emerge in the coming days, but many are certainly holding thumbs that the mother city will begin to find some relief. Reverend Andrews, CGTN, Cape Town.
Somalia's health ministry says its acquisition of new diagnostic and testing equipment will lead to faster identification of any COVID-19 cases in the country. The country says it will continue working with international partners to ensure the accuracy of all tests. CGTN's Abdulaziz Bilo reports from Mogadishu.
The latest case is the first confirmation of local transmission of the disease, almost 3 weeks since the Horn of Africa nation recorded its first imported case of the coronavirus. 3 foreigners are among the confirmed cases, 2 of them work as contractors with the United Nations mission in Somalia. The health ministry, however, says future tests will be faster following the acquisition of new diagnostic and testing equipments.
Our biggest concern was lack of testing facilities and equipment that prevented us from knowing if a person has COVID-19 or not. Now we are expecting additional equipment with support from WHO and members from the private sector.
This hospital in Mogadishu is the only isolation and treatment center designated for COVID-19 patients. It has limited bed capacity. There are concerns that more cases will be recorded as health officials embark on mass testing of people.
We have embarked on mass testing, and so far we are analyzing 15 samples. After the test is done, we have to seek confirmation with WHO certified laboratories. The good news is we can now confirm cases locally in a faster way than before.
Experts have warned that an outbreak of COVID-19 in Somalia could be worse than in any other country. For now, health officials say that early tracing, tracking, testing and treating all suspected cases remains key in preventing a potential outbreak.
It is important to note that this disease can only be contracted through close contact. Therefore, it is my appeal that people stay at home, pray from their homes, as we all join hands to defeat this disease. We will put in force all the powers of the federal government to protect our people from this contagious disease that includes massive awareness and preparedness.
Meanwhile, a ban on all local and international flights remains in place, with schools and universities closed for the 3rd week now, as authorities struggle to mitigate the impact of the virus. Abdulaziz Bilo, CGTN, Mogadishu, Somalia.
In Ghana, the government has announced it will cover the water bills of citizens for the next 3 months. The assistance is meant to encourage people to keep good hygiene and curb the spread of the coronavirus. But people living in areas without piped water say the government should prioritize supplying water to all first. Here's CGTN's Nabil Ahmed Rufai with that report from Accra.
The search for water is a daily routine for residents of Nima, a suburb of Accra.
many homes are not connected to piped water.
We hardly get water in this community. Sometimes our taps do not flow for months and we have to travel long distances to get water.
Keeping good hygiene through frequent washing of hands is key in preventing the spread of the coronavirus. But people in homes that don't have piped water are finding it difficult to do so. Hajia Jara sells water in this community. She says the government's plan to pay the water bills of all Ghanaians for the next 3 months may not benefit residents of Nima.
We use electricity to pump the water from other places that have water and then sell. If we stop taking money from those who come to buy the water, we can't pay the electricity bills and also maintain the pumps when they get faulty.
The Ghana Water Company says the country needs 249 million gallons of water a day, but it can only generate 192 million gallons daily. That is why communities like Nima face a shortage of water. But the government says it will ensure free water supply for all during the coronavirus crisis.
All water tankers, publicly and privately owned, are also going to be mobilized to ensure the supply of water to all vulnerable communities.
But many residents in Nima want the government to do more. Many homes here suffer erratic water supply. That's something they want fixed when the coronavirus pandemic is over. Nabil Ahmed Rufai, CGTN, Accra, Ghana.
In Abidjan, the wearing of masks is now compulsory as the number of COVID-19 cases increases. The country now has more than 300 reported infections. Consumers say masks approved by health services are scarce and expensive. Many are now turning to locally manufactured protective gear. Most of the mufflers worn by people in the streets, though, are made of fabric. The effectiveness of these remains to be proven. The government ordered the closure of workshops and shops in the market areas, forcing manufacturers to work secretly for fear of reprisal. Makeshift stores have been set up while sewing is done inside closed workshops. A piece of fabric and a few centimeters of elastic is the material needed for the design. Citizens are forced to pay costly prices to have a certified nose mask that they can only use for up to 4 hours. This is against using a locally made washable and reusable mask used for longer periods. However, their decision poses further risk to their health despite the challenge.
It is not amusing that we wear this kind of muffler. As you can imagine, it is not easy to breathe with these fabric mufflers, but the mufflers that are recommended in the pharmacies cost 3,000 francs per unit, and we have to change them every 4 hours. So we are forced to fall back on these fabric mufflers, whose prices vary between 100 and 200 francs. Also, it is reusable.
We are obliged to tolerate the wearing of fabric masks since they allow the individual, whether he is sick or not, to protect themselves. However, in terms of their effectiveness, in terms of gene filtration and effective barrier, these are technical aspects that we will see later.
The Chinese embassy in Tanzania has donated the first batch of medical protective materials to the country. This will enhance the capacity of the East African nation to fight the COVID-19 pandemic. Now, this includes 100,000 masks, 1,000 protective suits, and 150 body temperature guns. The medical supplies were purchased and donated by the Chinese embassy and 2 Chinese companies in Tanzania. The Tanzanian government has expressed gratitude, thanking China for its support. Tanzania also received a consignment of medical materials donated by Chinese billionaire Jack Ma. Tanzania currently has over 20 confirmed cases of COVID-19. Well, Nigeria has received epidemic prevention materials it purchased from China in efforts to deal with the COVID-19 outbreak. The anti-epidemic items include ventilators, protective clothing, and protective glasses that are in short supply in Nigeria. Now, in addition, a team that has been dispatched to the country will share prevention and control experience with the Nigerian Health Department. The group is part of the China Railway Construction Corporation. Medical staff who've worked in the field while combating the coronavirus will share their experiences in prevention and treatment measures. The initiative will take place over the next 30 days. 2 hospitals will also be built in Abuja at no cost, providing approximately 450 beds. Nigeria's Minister of Health has welcomed the initiative.
Experts from China, the technicians and the medical personnel who are able to give us information on not only on public health aspects, but also on case management.
Well, time for a short break. Your business news up next. OPEC members and other oil producers set for a virtual meeting to steady oil prices. Kenya's hospitality sector takes a huge blow from the effects of the coronavirus pandemic.
Africa is the nexus of enterprise, and global business will tell you why it matters.
From the mega investment projects to multi-billion-dollar mergers and acquisitions.
Africa today collects, just in terms of revenues from taxes alone, $545 billion a year. If you take 10% of that and you devote it to the energy sector, problem solved.
All this on Global Business, weekdays at this time on CGTN.
Africa Live. Find your voice.
The Organization of the Petroleum Exporting Countries, known as OPEC, and allied oil producers will hold a virtual meeting on Thursday to decide on global crude production that could make or break the oil market. Experts say OPEC's discussions will be centered around cuts of 8 to 10 million barrels per day over 90 days. The meeting is likely to focus on fine-tuning the amount and allocating quotas to each partner. Saudi Arabia lifted its production to 10.15 million barrels a day in March. That's just above its quota of 10.14 million barrels. This according to a survey conducted by S&P Global Platts. The kingdom, along with the United Arab Emirates and Kuwait, contributed to OPEC production of 28.97 barrels a day in March. That's up 980,000 barrels a day from February to reach a 3-month high. Now, the effects of COVID-19 on economies will be far-reaching, pushing millions of people into unemployment. The United Nations is warning half of the jobs in Africa could be lost, with income losses topping $220 billion. In Kenya, the country's top foreign exchange earner, the hospitality sector, has already taken a major hit, with thousands of workers laid off. CGTN's Robert Nagila has this report.
Each time Lindy Mtongana returns home, his wife ensures he sanitizes his hands before settling down. Up until recently, he worked as a food and beverage supervisor at an international hotel in Nairobi.
We were told now we have to vacate the hotel and go for our leaves because of the corona COVID-19.
He's among the lucky ones. He's on paid leave, at least for now. Many workers in the industry were not so lucky. Restrictions on foreigners coming into Kenya, the shutting down of hotels and entertainment sports have seen at least 12,000 workers in the tourism sector lose their jobs in the past month. Rickson says the psychological impact of COVID-19 is also taking a toll on his family.
Wow, it's a big change. There's a big change. Mostly my kids. So one is they are not allowed to go outside and play. You know, kids and play is one thing. Secondly, the church. They don't attend the church as we used to attend.
In addition to the threat to public health, economic and social disruptions threaten the long-term well-being and livelihoods of millions.
So most of the measures that I'm seeing being put in place are reactive measures, knee-jerk reactive measures, just to make sure that the business is not suffering from COVID-19 or reducing the impact of COVID-19.
Experts say employers should first exhaust all avenues before laying off staff.
Unpaid leave, for example, and also taking the pay cuts. But what employers need to understand is before you implement any of those change of contract terms, you have to consult with the employees.
Understanding is required from both sides. Back at Rickson's house, the Bible has become a major source of companionship in these uncertain times. When or if he'll be called back to work is not certain anymore. Robert Nagila, CGTN, Nairobi, Kenya.
South Africans have joined hands to fight the coronavirus after an appeal by government asking them to rally behind the cause. And as CGTN's Angela Coppola reports from Johannesburg, private companies and charities are playing a key role in that fight.
There are many charities and foundations that have heeded the government's call to get involved and donate time, money and resources.
We just want to pay tribute to both Patrice and Precious as brothers and sisters, but as South Africans who have really come in when there were challenges and stepped in for the good of the nation and made a contribution. It's a very, very important contribution in the amount that are being donated, but the nature of the contribution to PPEs is actually helping us solve a huge amount of problems.
The government and charities want to channel their resources where they're most needed, but to do this they need accurate and up-to-date data.
It's so encouraging to work with people who can give you data. Yeah. Data is very, very important. When the minister stands out there every morning and tells us we have so many infections, there are so many people that have died, that's important information because it helps us to see where we should be focusing on where we're working as well.
This will involve proper planning and logistics and working with many sectors from business to labour, NGOs and the government as they source protective gear. But the government is hamstrung because of its slow buying procedures.
The minister hasn't been sleeping. The deputy minister and the MEC and others have, over the last few weeks have been phoning all that so that the minister will then be in a position to distribute.
Donations have been coming in from many other well-off South African families. South Africa's biggest listed company, Naspers, is buying $55 million worth of PPE from China in partnership with the Chinese government and Tencent. And that's to support South Africa's health workers.
The President has called for all hands on deck. That means corporates, citizens, NGOs, stakeholders that are involved in the country and making sure that everybody gets through this coronavirus in a healthy state. It's going to take a lot of money and a lot of coordination. I'm Angelo Coppola for CGTN in Johannesburg, South Africa.
Now, international trade is forecast to fall between 13 and 32% this year as the coronavirus pandemic causes massive damage to global commerce. The World Trade Organization said in a fresh report that the drop will be worse than during the global financial crisis of 2008-2009. The WTO says the wide range in its forecast is due to the unpredictable nature of the pandemic. Governments worldwide have locked down businesses and travel to contain the outbreak, disrupting supply chains. According to the report, the scale of any recovery next year is equally uncertain. But WTO Director General Roberto Azevedo believes the global economy can bounce back if countries work together instead of acting alone.
Every spring, WTO economists issue a forecast for global trade. This year's forecast is different, however. COVID-19 has toppled the global economy, creating enormous shocks to supply and demand. We project that trade will fall steeply in every region of the world and across all sectors of the economy. In an optimistic scenario, our economists see the volumes of global trading goods tumbling by 13% in 2020. Now, if the pandemic is not brought under control and governments fail to coordinate policy responses, the decline could be 32% or more.
European Union finance ministers failed to agree on a $543 billion package to mitigate the economic impact of COVID-19. This has prolonged a paralysis that casts doubt over the bloc's ability to weather the crisis. In an emergency teleconference that lasted more than 16 hours, finance chiefs couldn't reconcile their contrasting views for the steps needed to help European economies recover. CGTN's Tony Waterman has more from Brussels.
EU finance ministers falling short on a new comprehensive coronavirus recovery package for the bloc worth nearly $550 billion.
Wir sind, was diese drei Vorhaben betrifft,
we almost agreed, but not quite yet. So it's a good message for now, and it concerns all three proposals.
eine gute Botschaft ist.
The three options on the table include a $110 billion scheme to support workers, a $220 billion loan guarantee program for ailing firms, and credit lines into the bloc's massive bailout fund for member states that need it. The devil, though, has been in the details.
This is not just about surviving the virus. It is about getting our economies back on their feet.
Ministers remain at loggerheads over a number of issues. Italy is adamant that no conditions be attached to loans from the $450 billion bailout fund. Rome believes that since the economic carnage hasn't been caused by poor financial decisions, the country's hardest hit shouldn't be penalized. The Austrians, Finns, and Dutch do want strings attached, and they aren't backing down. There's also the issue of corona bonds, which would allow for the joint issuance of debt. 11 member states are in favor, but the fiscal hawks of the North are resolute in their defiance. Despite the clashes, some progress appears to have been made. The Dutch finance minister tweeted that the group had agreed on the European Investment Bank's proposal to support struggling firms. It's a step in the right direction as finance ministers struggle to close the deal before the Easter holiday and prove the bloc is united in its fight against coronavirus. Tony Waterman, CGTN, Brussels.
Ethiopia's national carrier, Ethiopian Airlines, says it has no plans to lay off employees during the COVID-19 period. Its business, however, has taken a hit, forcing the carrier to slash almost 90% of its passenger operations. CGTN's Coletta Wanjoyi reports from Addis Ababa.
With different countries administering partial and total lockdowns, Ethiopian Airlines has been forced to suspend flights to 91 of its 110 international destinations. Ethiopian Airlines says in a day it would do at least 350 flights, but now it can only do 50. Of these, only 10 are international flights. This has translated into losses.
And as we speak, Ethiopian Airlines has lost a revenue of $550 million US dollars, including April, because we know our loss in April, we are not flying. So April included, between January and April.
The airline says it has permanent, contract, freelancers and seasonal workers. Each category has different terms of service during this low business time.
Ethiopian Airlines has not laid off any employee. And Ethiopian Airlines has no plans to lay off any employee.
The chief executive officer says the services of some contract workers, most of whom are usually retired staff who come back on call, will be put on hold for now. And talks are on with others to take a break, but with pay.
There is some confusion with about 596 contract employees who are currently on vacation, but they may exhaust their 2019 last year vacation. In that case, when they exhaust their 2019 vacation, either we'll give them their 2020 advance vacation in advance, or they may choose to take some a month or two unpaid leave. That we will decide when they exhaust their 2019 vacation.
The airline says it is planning to remain in the skies throughout the COVID-19 period. Coletta Wanjoyi, CGTN, Addis Ababa, Ethiopia.
Well, it's time now for a short break. Here's what's still ahead on Africa Live. Egypt develops disinfectant walk-through gates to help prevent the spread of COVID-19.
Join us in Global Business and see Africa through our eyes. The greatest journeys, the greatest sights, the greatest adventures.
Here in Qanater, this weir allows the locals to walk on water.
We're far more than just TV news. We're your passport to the wonders of Africa.
to bring you stories of struggle, survival and hope.
So let's explore. CGTN. See the difference.
President Donald Trump has threatened to freeze funding to the World Health Organization. He has accused the body of withholding information about the coronavirus outbreak in its early days. The WHO chief, however, has defended the organization's handling of the pandemic and called for unity and an end to what he says is the politicization of the COVID-19 pandemic.
Many in the continent say President Donald Trump's call for unfounded fuss and a serious diversion from the real challenge, the uncontrollable corona pandemic situation. Trump claims WHO and its administration are China-centric. He also said he will slash funding to the global organization. The African Union first and several heads of state and governments right after have responded to President Trump's claims. AUC chairperson Mosa Faki Mohammed said, and I quote, "Surprised to learn of a campaign by the US government against the WHO's global leadership. The African Union fully supports WHO and Dr. Tedros. The focus should remain on collectively fighting COVID-19 as a united global community. The time for accountability will come." End of quote. Rwanda President Paul Kagame, agreeing with AUC chair's comments, said, "Is it Dr. Tedros, WHO, China under attack, or all of them together? Let's focus on the fight against this pandemic. Whoever should be held accountable will come later and done properly. Save us too much politics. Africa does not need it. Who does?" he asked. End of quote. Similar messages of solidarity were also sent out from across the continent against Donald Trump's current stand. Many individual Africans and US nationals alike are angered and outraged by the claim President Trump has made against WHO and Director General Tedros Adhanom. They too call upon all sides, especially the Trump administration, to focus on saving lives, not sharing blames. Grumtara CGTN, Addis Ababa, Ethiopia.
Now, an Egyptian citizen has, with the assistance of a team of experts from Mansoura University, manufactured gates to disinfect people and help prevent the spread of COVID-19. Haitham Al-Badawi, who manages a university sports complex, used his background in fixing computers to create the new electronic gates. CGTN's Adel Al-Makhroui reports from Cairo.
When COVID-19 broke out, Haitham al-Badawi was concerned about the safety of the hundreds of visitors to the Olympic village he manages. Before Egypt reported any case, he formed a team of experts from Mansoura University to look for a solution.
We saw Wuhan and were wondering what will happen when the virus comes and how the sports village could be affected. So we started thinking of ideas of efficiently disinfecting the huge numbers who enter our sports complex. I saw how China disinfected people moving from one province to the other manually. That sparked the idea. We wanted it to be a mandatory disinfectant process to all the visitors.
In just 2 weeks, al-Badawi had a prototype, a pedestrian's metal gate that sprinkles disinfectants. The disinfectant used doesn't contain chlorine and is therefore safe to inhale. It also doesn't damage clothing.
We've carefully selected the disinfectant used based on WHO recommendations. We break down these liquids into droplets, which are not harmful at all. For every 1 meter square of surface area, we must spray 20 milliliters of this material. We've calculated the average body of humans and figured we need to spray 60 milliliters.
Testing is still underway to see how effective this model is in killing the coronavirus as well as other viruses. All materials used are made in Egypt, making local production attainable. This small team has the capacity to produce 5 gates daily.
We want to serve our country, to represent something that helps Egypt in the emergency circumstances we're living in. We're not putting a profit margin. We're only covering the cost. Our design is very flexible, so it can be tailor-made for different purposes.
The gate's price starts at $300. It can be equipped with thermometers to measure visitors' temperature. Keen to create a solution to protect their community, this team has created a useful invention that could benefit the entire country and probably the world. Adil Mahroui, CGTN, Cairo.
And coming up in your sports news, up next. In sports, the